This is Chris S.J., and this is a brief PowerPoint of drugs in the workplace and what indications a supervisor can look out for if they believe someone may be under the influence of drugs and or alcohol in the workplace. In this PowerPoint, I will go over what classes of drugs are tested for by the Department of Transportation. The classes of drugs that are tested for are marijuana, cocaine, opioids, phencyclidine, better known as PCP, amphetamines, including methamphetamines, and alcohol. For all these types of drugs, there are 4 types of indications to look out for. There is physical indications, behavioral indications, speak indications, and performance on the job. First is marijuana. More specifically, what we're looking for in a drug test is THC. With new state laws on the medical and recreational use of marijuana, supervisors need to be more keenly aware of the signs of marijuana usage at the work site. Here are some slang names that marijuana goes by, and they are weed, bud, ganja, grass, Mary Jane, spliffs, and joints. What are the signs of usage in the workplace? Physical indications can be bloodshot eyes and odor of marijuana on persons. A behavioral indication can be impaired coordination, overly relaxed attitude, and overly relaxed body language. Speech indications persons may seem anxious when speaking, and speech may be slower. And performance indications are forgetting how to perform tasks and may do tasks they are accustomed to wrong. Next is cocaine. Cocaine may be used by workers that work long shifts so they can stay awake and be more alert. Some names that cocaine go by are coke, blow, powder, white girl, crack, rock, and base. Some physical indications of cocaine usage may be dilated pupils, a runny nose, fidgety, and weight loss. Behavioral indications may be mood swings, paranoia, and a person may become very talkative. Performance indications may be legal issues that keep them away from work, decrease work performance, overconfidence in their abilities, and risky behavior. And speak indications may be overexcitement when speaking and talking more than usual. Next is opioids. Because opioids are prescribed by doctors for pain management, they can easily become addicted to and abused if usage is not properly monitored. Some slang names that opioids may go by are oxys, scissor, which is a mixture of codeine, cough syrup, 7-Up, and Jolly Ranchers, heroin, smack, and junk. Some physical indications of opioid abuse are needle marks, constricted pupils, weight loss, appears drowsy at all times, and clammy appearance. Some behavioral indications are engaging in risky behavior, more than normal trips to the bathroom to shoot up, mood swings, and high count of missed work days. Speech indications may be slurred speech, slower speech, and mumbling. And some performance indications may be drops in performance at work, may fall asleep at work, and may take unnecessary risks. The next slide is phencyclidine, better known as PCP. Some people are unaware of what PCP actually is. PCP is a dissociative anesthesia that has a hallucinogenic property depending on the dosage. Some names that PCP will go by is horse, angel dust, and sherm. The physical indications of a user may be a user may experience vomiting, sweating, and heavy breathing. Some behavioral indications: user may have physical distress, extreme fear or panic, or maybe become very aggressive. Speech indications may seem confused when spoken to or speaking, increased rate of speech, and may say things that does not make sense. A performance indication can be reckless behavior in the workplace because of the hallucinogenic nature of the drug. The drug is not commonly used in the workplace because of the nature of the drug. The next class of drugs is amphetamines, which includes methamphetamines, MDMA, and MDA. Amphetamines, like cocaine, may be used by workers that work long shifts so they can stay awake and be alert on the job. Some names and slang names of amphetamines and methamphetamines are Adderall, Ritalin, uppers, meth, crank, ice, ecstasy, and Molly. Physical indications can be jittery, sweating, skin sores, and rotting teeth, better known as meth mouth. Behavioral indications are overly energetic, mood swings, person may seem nervous, and hyperactivity. Speech indications: user may become more talkative and may speak at faster pace. Some performance indications are a user may become overconfident in their abilities, person may have decreased performance because of being awake for long periods of time, and increase in on-site accidents. And finally, we come to alcohol. Alcohol is the most widely used and abused drug because of its easy access and being such a big part of American society. Virtually everyone has had a few drinks during a family get-together or at the game. Some physical indications of alcohol use at the job are slurred speech, odor of alcohol on person, being unusually uncoordinated, and advanced aging. Behavioral indications: hiding alcohol in drinking cups or thermos, high number of missed workdays, especially around weekends and holidays, and mood swings. Speech indications: slurred speech and trouble holding a conversation. Performance indications: drop in work output, takes unnecessary risks at work, and high workplace injury rate.